Bringing a single new drug to market takes an average of 10 to 12 years, costs roughly $2.5 billion, pause 1.5s, and has a failure rate of over 90%, pause 1.5s.
Yeah, and it is a phenomenon known structurally in the industry as Eroom's law, which is, it's the exact brutal opposite of Moore's law.
Right, because instead of things getting cheaper and faster, they are just exponentially slowing down.
Exactly. I mean, while computing power has compounded exponentially over the decades, drug discovery has become exponentially more expensive. For the last half-century, really, Eroom's law has been this invisible anchor dragging down the entire global medical system.
Welcome to today's deep dive. We are setting out on a very specific mission today for you. We're going to explore what the data suggests is, well, frankly, the greatest wealth creation engine of the 21st century.
We're talking about the complete digitization of human biology, a field that is now structurally categorized across the market as TechBio.
Right. And it's a profound transition, right? Because we are no longer just observing biology through a microscope and trying to react to it.
No, not at all. We have reached a point where we are engineering it from the ground up.
Yeah.
We are treating human biology essentially as an information technology.
Exactly. And to guide you through this, we have a clear data-driven roadmap. First, we're going to unpack the actual mechanics of how generative artificial intelligence is designing completely novel proteins from scratch.
Which fundamentally solves a bottleneck that has plagued chemistry for decades, by the way.
Right, it's huge. And then we are going to map out the economic realities of the local AI longevity clinic. This is a fascinating structural shift in how healthcare is delivered, monetized, and transitioned into recurring revenue.
And finally, we will reveal the specific, non-obvious picks and shovels investment playbook for this new era.
But I do want to set a firm expectation for later in this discussion. We are going to explore the dark side of this technological leap in pretty extensive detail.
Yeah, we have to. Because when biology becomes programmable, I mean, when you can literally type a text prompt and generate a new biological entity, the barrier to extreme bioterrorism completely collapses.
It's terrifying, honestly. The implications for national security and just the fundamental structure of human inequality, they are staggering.
They really are. It's something we need to unpack carefully.
Absolutely. So, let's start by framing the magnitude of the biology bottleneck and what it actually means to end the era of guesswork. Let's look at the sheer scale of the problem.
Right, because if we are going to understand how artificial intelligence is changing medicine, we have to understand the physical architecture of the human body first.
And the complexity there is almost incomprehensible when you look at the raw numbers.
It is. I mean, you sitting here listening to this right now, you are not a single unified organism in the way we traditionally think about it.
Right, you're a walking colony.
Exactly. You are a highly coordinated walking colony of roughly 30 trillion individual cells. Pause 1.5s.
30 trillion separate biological machines all operating simultaneously.
Correct. And inside almost every single one of those 30 trillion cells is a nucleus. Tucked inside that nucleus is a tightly coiled thread of DNA.
Which, if you stretch it out, is pretty long, right?
Yeah, if you stretch out the DNA in just one single cell, it is about 2 meters long.
Wow. And structurally, that DNA is essentially just software, isn't it? It's just code.
Precisely. It is a biological software code written in a tiny 4-letter alphabet of chemical bases. So you have adenine, cytosine, thymine, and guanine, or A, C, T, and G.
Okay, so let's look at the timeline here. For the last 20 years, essentially since the completion of the Human Genome Project back in 2003, the industry has possessed the technology to read that code.
Right. We map the genome, we digitize the 3 billion base pairs.
Mm-hmm.
But here is the crucial distinction that the market completely misunderstood at the time.
Right, because reading the code did not magically cure human diseases.
No, it didn't. And I remember the public narrative back then. Everyone thought mapping the genome was the ultimate finish line.
Yeah, the assumption was, oh, once we have the map, we'll just cross out the bad genes and cure cancer.
Exactly. It was heavily hyped, and frankly, it led to a massive misallocation of capital because people misunderstood what DNA actually does.
It's just a storage drive.
Yes. Knowing the sequence of DNA only gives you the blueprint. It doesn't tell you how the house is actually built or how the physical materials interact with one another.
So who are the actual workers then?
The true workers in the cellular factory? The molecules that physically build the structures, carry the signals, break down your food, and execute the commands of the DNA, those are proteins.
Right, so if DNA is the blueprint sitting safely in the architect's office, the proteins are the construction workers, the scaffolding, and the cement mixers actually out on the site.
That is an excellent way to frame it. Chemically, proteins are long, complex chains of molecules called amino acids.
And there are 20 standard amino acids.
Yeah, 20 standard ones. And your DNA dictates the sequence in which these amino acids are strung together. But, and this is key, they do not just sit there in a straight line like beads on a string.
They fold up.
Right. Through the laws of physics, electrostatic attraction and repulsion, they immediately fold themselves into incredibly intricate three-dimensional origami shapes.
And from what I understand, that physical three-dimensional shape is really the only thing that matters.
The shape completely dictates the biological function. If a protein folds perfectly into its intended shape, your body functions normally.
But if it misfolds...
If a protein misfolds, even slightly, if a single microscopic ridge is in the wrong place, the results could be catastrophic.
Like diseases.
Exactly. That precise misfolding is the root physical cause of degenerative diseases like Alzheimer's and Parkinson's.
Wow.
Conversely, if a virus, like a coronavirus, has a spike protein that happens to have the exact right three-dimensional shape to perfectly dock with a receptor on the outside of your lung cell, well, you get infected.
So it is entirely a game of physical shapes interlocking, like these complex three-dimensional puzzle pieces.
That's all it is. Which brings us to the core reason why Big Pharma has struggled so immensely, and really, why Eroom's law exists in the first place.
Because historically, the pharmaceutical industry has essentially operated on blind, stochastic guessing for the last 50 years.
Exactly. When you have a disease caused by a specific protein receptor, traditional drug discovery basically involves mixing millions of random chemical compounds in test tubes.
Just hoping that one randomly shaped molecule will happen to fit perfectly into the microscopic pocket of that target protein.
Yeah, it is an incredibly inefficient use of capital and time.
The analogy that comes to mind for me is being a blindfolded locksmith. There is a lock on a door somewhere in this massive mansion. You have a bucket of 1 billion randomly cut keys.
And you're just walking around in the dark.
Right. You're jamming keys into the door, hoping one turns. And most of the time, the key doesn't fit. Or worse, it fits into the wrong door and causes a massive side effect.
Which is exactly why drugs fail in late-stage trials. The key opened a door in the heart instead of the liver.
Okay, so let's talk about the old way we tried to solve this before AI entered the picture. How did scientists actually look at the shape of these proteins?
The primary legacy method is a process called X-ray crystallography.
And how does that work?
Well, to figure out the three-dimensional shape of just one single protein, scientists first had to physically isolate it and coax it into forming a solid crystal.
That sounds difficult.
It's incredibly difficult. That alone could take months or even years of trial and error because proteins are dynamic moving things. They do not want to be frozen into a crystal lattice.
So you are basically forcing a biological machine to freeze in place.
Yes. And once you finally get a crystal, if you do, you shoot a high-powered beam of X-rays through it.
Okay, and then what happens?
The X-rays hit the atoms in the protein and scatter. By capturing that scatter pattern on a detector, a researcher can mathematically work backward to determine the position of every single atom.
That sounds like a painstaking manual process.
It is. Historically, mapping one protein could take a PhD student 3 to 5 years of dedicated laboratory work and cost millions of dollars in equipment time.
And to put that in perspective, how many unique proteins actually exist?
There are roughly 200 million known proteins in nature across all forms of life.
Oh, wow. So doing that one by one.
Yeah, if the industry had kept operating at the old pace, relying entirely on physical X-ray crystallography and cryogenic electron microscopy, the data suggests it would have taken humanity over 1 billion years to map them all.
1 billion years.
We were essentially flying blind in a universe of molecular dark matter.
But then, the trajectory of biology violently intersects with the trajectory of artificial intelligence. Let's look at the AlphaFold breakthrough, because this is where the bottleneck finally breaks.
This is the inflection point, absolutely. DeepMind, which is the artificial intelligence subsidiary of Alphabet, looked at the protein folding problem and realized something fundamental.
That trying to physically map them was a losing battle.
Exactly. They decided to treat protein folding not as a wet lab chemistry problem, but as a pure data and physics problem.
How exactly did they approach that structurally from a data perspective?
Well, they took the database of the roughly 100,000 proteins that human scientists had already painstakingly mapped over the last 50 years.
Using the X-ray method.
Right. They fed that exact, verified structural data into a deep neural network, alongside the one-dimensional amino acid sequences.
Okay, so they essentially told the AI, here is the linear string of amino acids, and here's the final 3D origami shape it eventually formed. Figure out the rules connecting them.
Yes. And by analyzing the distance between atoms and the angles of the chemical bonds across 100,000 examples, the AI slowly learned the underlying quantum physics.
It learned how these molecules push and pull against each other.
Exactly. It learned the physical rules of the biological origami through pattern recognition. And once the neural network understood those fundamental rules, it no longer needed a physical laboratory.
Could just predict it.
Right. It could look at any sequence of DNA, identify the amino acids it would produce, and predict the final three-dimensional structure of that protein with near atomic accuracy.
Not in 3 to 5 years, but
In hours. DeepMind released a database predicting the structure of almost every single known protein on Earth. Over 200 million structures.
So the dark room is suddenly flooded with light. We can suddenly see the shape of every single lock in the mansion.
We can see all of them.
But here is where the timeline accelerates from a historical breakthrough to genuine awe at what is happening in the market right now. Because the AI models in TechBio are no longer just acting like advanced search engines looking for existing shapes.
No, they have completely transitioned into generative engines.
Which is a monumental phase shift. We have moved from predicting existing biology to generating entirely novel biology.
Yeah, in the industry, this is referred to as generative chemistry, or writing the code of life.
I want to break down exactly how this works, because honestly, it sounds like science fiction until you look at the math. We know these models use the exact same underlying architecture, diffusion models and large language models, as the AI image generators that create photorealistic pictures.
Right, or the text models that write essays.
But instead of hallucinating pixels or text, they are hallucinating complex molecular structures.
Exactly.
So my question is, how do you actually prompt an AI for a life-saving drug? Like, if I am a pharmaceutical architect, what am I literally typing into the terminal?
The prompt is incredibly specific. It's highly constrained and deeply technical. If a TechBio company is targeting a specific cancer, a pharmaceutical prompt fed into the generative AI would look something like this.
Okay, what is it?
It would be design a novel, non-toxic, small molecule protein that binds exclusively to this specific three-dimensional cancer receptor. The molecule must be stable enough to survive the highly acidic environment of the human stomach. It must have the exact lipid solubility required to cross the blood-brain barrier, and it cannot bind to any of the standard receptors in the human heart.
That is staggering. You are not just asking for a molecule, you are giving the AI a multivariable checklist of extreme biological constraints.
Yeah, you're giving it an impossible puzzle for a human to solve manually.
And the math behind what the AI does next is what really shifted my perspective on this entire industry. The AI takes that prompt and begins searching through what data scientists call a latent space.
Right, the latent space.
Wait, let's pause here, because I hear the term latent space thrown around constantly in artificial intelligence discussions. What does it actually mean in the context of generating a drug?
It is a critical concept to grasp if you want to understand the economics here. Imagine a vast, multi-dimensional map. In a normal two-dimensional map, proximity tells you about geography. Right. New York is close to Boston. But in a chemical latent space, the AI has mapped out every possible combination of atoms that could theoretically form a stable drug-like molecule.
So on this map, what does proximity mean?
Proximity equals structural and functional similarity. Two molecules that are close together in the latent space will behave similarly in the human body.
And how big is this map?
The estimated size of the chemical latent space for small drug-like molecules is roughly 10 to the power of 60. Pause 1.5s.
10 with 60 zeros behind it.
Yes.
Just to contextualize that for you, that is astronomically larger than the number of atoms in the entire solar system.
It is an incomprehensibly vast space of chemical possibilities. A human chemist could never explore even a fraction of it.
But the AI can.
Right. Using vector mathematics, the AI can navigate this latent space instantly. It hallucinates millions of potential molecular structures that fit the parameters of your prompt.
And then what? It just gives you millions of options.
No, then Internally, inside the computer's memory, it runs physics-based simulations. It tests how strongly each of those generated molecules binds to the target cancer receptor.
So it's basically doing the lab work digitally.
Exactly. It systematically filters out the toxic ones. It optimizes the remaining candidates to ensure they can actually be manufactured at scale in a physical lab.
So within a matter of days, the AI outputs a shortlist of perfect, entirely novel molecules that have literally never existed in the history of the universe, but perfectly solve the biological problem.
Yes, and this is not theoretical future casting. I mean, in the window 2024 and 2025, the very first entirely AI-designed drugs officially entered human clinical trials.
Is that fast?
Yeah, companies executing this playbook took a discovery phase that traditionally required 4.5 years of grueling, highly expensive laboratory guesswork, and they compressed it down to just 18 months.
The economics of that compression are just undeniable. Whenever an industry transitions from relying on physical, manual experimentation to relying on high-speed information processing, the marginal costs plummet to near zero.
And the pace of innovation goes completely vertical.
Right. That is the macro thesis. But if we are looking at this structurally as analysts, we have to connect this pure software breakthrough to the physical limitations of the real world.
Because AI is incredibly intelligent, but biology is messy.
Exactly. An algorithm still needs to interact with physical reality to validate its hallucinations. It needs closed-loop feedback.
Which brings us to a very important, grounded reality check about this industry. It is a cautionary business lesson that directly challenges the popular narrative currently driving venture capital markets.
Let's look at that. Let's look at the contrarian take on TechBio.
So the popular narrative, the one you see driving retail investment and early stage funding, assumes that the AI algorithm itself is the ultimate competitive advantage.
Right, you hear AI drug discovery, and the market assumes the proprietary code, the mathematical model, is the golden ticket.
It makes intuitive sense to most tech investors, sure. If you have the smartest AI, you win the market.
But you're saying that's wrong.
It is a trap. It is the trap of pure software. And it is a fundamental misunderstanding of how machine learning actually scales.
How so?
Over a long enough time horizon, open source models inevitably commoditize the software layer. Mathematical architectures leak. Compute power becomes cheaper. The algorithms themselves will eventually become an accessible utility, kind of like electricity or cloud hosting.
So if the code isn't the moat, what is?
The real economic moat in TechBio, I mean, the only defensible asset, is proprietary data.
Okay, let me explain why. Because if you train a brilliant state-of-the-art AI algorithm on public, messy, biased biological data pulled from decades of disparate university research papers, your AI is going to output mediocre, biased molecular designs.
The old computing adage applies ruthlessly here. Garbage in, garbage out. Public databases are filled with experimental errors, inconsistent temperatures, and varying protocols.
And AI cannot learn the absolute truth of physics from flawed data.
It just can't.
Which leads us to the structural solution. How do the leading companies actually acquire perfect data to train their models?
This introduces what the industry calls the lab-in-the-loop model, and the physical infrastructure here is deeply impressive.
We're talking about the rise of cloud labs. To picture this, I want you to imagine a warehouse the size of a professional football field. But instead of being filled with forklift drivers moving pallets of consumer goods, it is completely devoid of humans.
It is an entirely automated environment running 24 hours a day. It is the ultimate industrialization of scientific experimentation.
So how does the feedback loop function economically and operationally in that space?
Well, an AI model sitting on a server farm designs 1 million potential drug molecules digitally. It then sends those digital blueprints directly to the physical cloud lab via an API. Inside that massive warehouse, robotic arms and automated acoustic liquid handlers take over entirely.
I want to pause on the acoustic liquid handlers for a second because the physical mechanism is fascinating. How are they moving these chemicals without human hands?
Right, so traditional biology involves humans using pipettes to move tiny drops of liquid from one tube to another. It is slow, and it introduces human error and cross-contamination.
Right, the messy part of biology.
Exactly. Acoustic liquid handlers, on the other hand, use focused pulses of sound energy to eject perfectly calibrated microscopic droplets of fluid Nanoliters, upward from one well into an inverted plate suspended above it.
Wait, using sound waves?
Yeah, the machine never physically touches the liquid.
So using sound waves, these massive robotic systems physically synthesize the million molecules the AI hallucinated. They actually print the chemicals into existence.
Exactly, they manufacture them physically. Then the automated systems transport those newly minted molecules to testing stations.
And test them on what?
They expose the molecules to living human cells in standardized petri dishes, and advanced sensors measure the exact biological response.
Like, does the cell die? Does the receptor activate?
Exactly. How fast does the reaction occur? Every single microsecond of that physical reaction is recorded.
Every variable is captured. The temperature, the humidity, the exact timestamp.
And that physical reaction generates pristine, highly structured, perfectly standardized data. That pure data is then fed directly back into the AI.
Through a process of reinforcement learning, I assume.
Yes. The AI analyzes its physical mistakes, updates the mathematical weights in its neural network, and designs an exponentially better, more refined batch of molecules for the next round.
So the money angle here is crystal clear. The company that manages to finance and build the largest automated robotic infrastructure and thereby aggregates the largest, cleanest, most exclusive biological data set through this physical feedback loop.
They win.
They're not just building a drug company, they are building the Standard Oil of the biotech century.
Without a doubt. If you want to own the future of medicine, you don't just build a better algorithm. You build a monopoly on the ground truth data.
You build the largest robotic data generation engine the world has ever seen.
Creating a flywheel that competitors simply cannot replicate without spending billions of dollars in years of time.
We have spent a lot of time analyzing the macroeconomic stratosphere, right? The billion-dollar corporate infrastructure, the cloud labs, and the massive data monopolies.
All right, the heavy industry side of it.
Let's transition our focus down to the local consumer level, because as an entrepreneur, an operator, or a private investor listening to this, you are likely looking for the direct commercial application of this technology.
Right, how does this affect you directly?
This shifts us into a highly actionable, structured playbook. We need to examine how this science is being monetized right now on the ground.
And the transition of generative biology from the corporate laboratory directly into the consumer market is accelerating faster than traditional regulatory bodies ever anticipated.
Which brings us to a specific real-world case study, the operational shift from fringe biohacking to the highly lucrative business-to-consumer AI longevity clinic.
This is a huge shift. For the last decade, the concept of longevity was largely associated with eccentric billionaires sleeping in hyperbaric chambers or taking unverified supplements.
Right, it was very niche.
But today, it is matured into a localized, highly scalable, data-driven business model. It represents a fascinating structural evolution in the economics of healthcare.
Because traditional medicine is reactive and low margin, you only engage with the system when something is physically broken.
Exactly. The AI longevity clinic model flips that into a proactive high-margin model. The operational playbook for these clinics typically follows a very specific three-step monetization structure.
Let's break down that playbook for the listener. What happens operationally in step one?
Step one is the digital twin onboarding. When a high-net-worth client walks into one of these physical clinics, they are charged an initial upfront fee, generally averaging around $5,000. Pause 1.5s.
Okay, and for $5,000, what do they get?
In exchange for that capital, the clinic captures a massive, comprehensive snapshot of the client's current biological state. They draw extensive blood panels, they fully sequence the client's genome to look for structural predispositions, and they map the gut microbiome.
And they also run an epigenetic clock test, right? Which is a term that probably needs a bit of explanation.
Sure.
If genome sequencing reads the blueprint of your DNA, what exactly is an epigenetic clock measuring?
Well, your DNA sequence largely doesn't change over your life. However, how your body reads that DNA changes based on your environment, your diet, and just general aging.
Okay.
Epigenetics refers to tiny chemical tags, specifically methyl groups, that attach themselves to your DNA over time, essentially turning certain genes on or off.
So it's like a dimmer switch for your genes.
Exactly. An epigenetic clock test measures the accumulation and pattern of those methyl tags. It allows the clinic to determine the physical wear and tear on your DNA.
So it tells them your true biological age, which might be very different from your chronological age on your driver's license.
Spot on.
Okay, so the clinic aggregates the genome, the microbiome, the blood chemistry, and the epigenetic data. They feed all of this localized, massive data into a proprietary AI system to build a digital twin.
Right, they create a highly accurate, virtual, simulated mathematical model of that specific client's metabolism.
That is step one. What is the operational output in step two?
Step two is the AI-generated protocol. This is the core value proposition of the entire business. The client is not receiving generic population-level advice like a standard general practitioner telling them to eat leafy greens and take vitamin D.
It's much more targeted.
The advice is hyper-personalized and hyper-specific. The AI cross-references the client's unique digital twin against millions of peer-reviewed medical papers and outputs a strict directive.
Give me an example. What does that directive look like?
The AI might output something like, based on a known mutation in your specific MTHFR genetic methylation pathway, your body cannot properly process standard folic acid. Therefore, you must take this exact dosage of a synthesized methylated folate compound combined with a specific peptide every morning at precisely 8 a.m. to optimize cellular repair.
The level of targeted precision is incredible, and that leads directly into step three, which is where the brilliant economics of the business model actually lock in.
The recurring revenue.
Step three is the recurring revenue loop.
Yes. The clinic does not just hand the client a static piece of paper and send them home. The client transitions into a monthly subscription retainer, typically ranging from $2,000 to $5,000 a month. Pause, 1.5s.
A massive monthly recurring revenue stream. What exactly are they paying for on a monthly basis?
Continuous monitoring and dynamic adjustment. To maintain the subscription, the client wears clinical-grade continuous glucose monitors embedded in their arm and biometric smart rings that track heart rate variability and deep sleep architecture.
So they're constantly streaming data.
This hardware streams real-time biometric data back to the clinic's servers 24/7.
So the clinic is constantly updating the digital twin based on real-time physiological feedback.
Exactly. And most crucially, from a margin perspective, these clinics usually operate an in-house compounding pharmacy.
Ah, that's where the vertical integration happens.
Right. The AI analyzes the continuous data, adjusts the required chemical dosages, and the automated pharmacy physically synthesizes and ships the exact personalized peptide and supplement stacks directly to the client's door every single month.
If we evaluate the pure economics of this model, it is strategically brilliant. It takes traditional healthcare, a low-margin, high-liability reactive system, and transforms it into a high-margin, proactive biological sauce.
Software as a service, but applied to human flesh.
Exactly. And it is specifically targeted at high-net-worth individuals who have realized that their metabolic health is their ultimate compounding asset.
It is the holy grail of business models. A high-ticket, extremely sticky recurring revenue stream backed by objective data.
Which naturally forces the question for anyone looking to allocate capital in the public or private markets. If this technology is expanding this rapidly, should an investor just buy stock in whatever early-stage startup issues a press release claiming their AI is going to cure Alzheimer's by the year 2030?
Absolutely not.
Yeah.
That is the quickest and most reliable way to destroy your capital.
Why? Because
investing directly in a specific AI drug discovery startup, especially at the retail level, is relying on binary venture capital math. You have to remember the regulatory reality here.
Right, the FDA.
Even with the most advanced AI generating a perfect molecule, that drug still has to pass rigorous, multi-year FDA Phase 3 clinical trials in human populations to prove efficacy and safety.
And a lot can go wrong there.
If the drug encounters an unforeseen biological complication in year 3 of the trial and fails, the company's valuation drops to zero overnight. It's essentially an expensive lottery ticket.
So if the direct play is fundamentally flawed for the average investor, where is the structural play? How do you position capital intelligently in this space?
You invest in the picks and shovels.
The old gold rush analogy?
Exactly. In any gold rush, the people who consistently make money are not the miners out in the hills. It is the merchants selling the tools, the denim, and the pickaxes.
You want to own the critical infrastructure.
Right. You want to own the infrastructure that every single one of these biotech companies, regardless of whether their specific proprietary drug succeeds or fails in clinical trials, is fundamentally forced to rent.
Based on the market data, we can outline 3 specific investment vectors, 3 categories of infrastructure to research this week. Let's walk through the playbook.
Okay. Vector number 1 is synthetic DNA and RNA manufacturing.
Think of these companies as the biological foundries.
Exactly. When an AI algorithm sitting on a server somewhere designs a novel digital protein code, that purely digital code has to be translated into physical reality.
It has to be printed.
It has to be physically printed into biological material so it can be tested in a lab. The companies that design, build, and operate these physical desktop DNA printers are the ultimate toll booths of the TechBio revolution.
Because they capture a fee every time the software touches reality.
Precisely. They generate revenue every single time an AI anywhere in the world decides to run a physical experiment. They are entirely agnostic to whether the drug cures cancer or fails completely. They get paid to print the code.
Vector number 2 in the playbook: biobanks and data monopolies.
As we established with the Cloud Labs discussion, the generative AI models require massive, diverse, incredibly clean data sets of human biology to train their neural weights effectively.
So whoever holds the data holds the power.
Right. Companies, or in some cases nationalized sovereign entities that have legally aggregated and own deeply phenotyped longitudinal health records of millions of patients, hold the absolute keys to the kingdom.
And we're not just talking about basic medical files like your height and weight. We are talking about multi-omic data. Let's clarify that term.
It's a critical term.
Multi-omic data means layering a patient's genomics, their DNA, on top of their proteomics, which are the proteins active in their blood, on top of their metabolomics, the chemical byproducts of their metabolism.
It is a complete, multi-layered, vertical slice of a human being over time.
Exactly. Structured, legally compliant multi-omic data is the new uranium. It is the incredibly rare, highly regulated fuel that is absolutely required to power the generative engines of the entire industry.
Pharmaceutical companies will pay exorbitant licensing fees to access these data sets.
And finally, vector number 3, lab automation and robotics.
These are often overlooked, boring, mid-cap industrial companies. They are not flashy biotech firms, they are precision manufacturing companies.
But they are essential.
They engineer and produce the physical hardware for the cloud labs. They manufacture the acoustic liquid handlers, the robotic incubators, the high-throughput mass spectrometers, and the automated conveyance systems.
Because of the global explosion of the lab-in-the-loop model, these industrial companies are currently sitting on multi-year order backlogs.
They are selling the heavy machinery to the AI gold miners.
It is the pure infrastructure of the future. But having laid out this immense technological power, the staggering wealth generation potential, and the genuine medical miracles that will undoubtedly occur, we have to pivot.
We do. We have an obligation to analyze the consequences.
What structurally happens to society when we wield this kind of foundational power?
This is where our analysis has to shift significantly in tone and focus. We have to look at the dark side of programmable biology. And the implications are severe, wide-ranging, and currently entirely unregulated.
We are going to dedicate serious time to this, because if we are turning human biology into an information technology, we are going to inherit all the traditional destructive externalities of the software industry, hacking, inequality, and systemic fragility, but applied to living organisms.
The first major structural risk the data points to is systemic bioinequality. In economic circles, they refer to this as the Elysium scenario.
The Elysium scenario is the concept of a literal biological divergence of the human species based entirely on capital allocation.
Let's run a thought experiment based on the AI longevity clinic model we just analyzed.
Okay.
If a clinic utilizing a perfect digital twin and an AI-generated peptide protocol can genuinely, demonstrably add 20 years of high-quality, healthy life to a human being, but the physical reality of maintaining that protocol costs $100,000 a year in recurring capital cost. Pause 1.5s. What happens to the macroeconomic structure of humanity?
The societal friction it will cause is mathematically terrifying. Historically, wealth inequality meant a divergence in assets. The wealthy had a nicer physical house, a better method of transportation, or access to higher quality food.
Right.
But ultimately, a billionaire and a factory worker both faced the same biological clock. They both aged at roughly the same rate, and they both had roughly 80 years to deploy their capital and influence.
Death was the great unavoidable equalizer.
Correct. But if advanced longevity technology is fundamentally gated by a high-ticket price, that equalizer disappears entirely.
The wealthy will no longer just have more money, they will have fundamentally more time. And in economics, time is the ultimate multiplier.
Let's compound that out over a century to see the true impact. Imagine a billionaire who can afford the $100,000 annual subscription.
Okay, so they are constantly optimizing.
Right. Through continuous AI intervention, they live to be 150 years old, but crucially, they maintain the cognitive sharpness and physical vitality of a 40-year-old.
The implications for capital aggregation are insane.
They will be able to compound their investment portfolios, their private equity holdings, their accumulated industry knowledge, and their deep political influence over century-long lifespans.
The consolidation of power would be unprecedented. Generational turnover, the natural process where power and capital naturally shift to the younger generation, that would just stall.
You would have a permanent, entrenched overclass of centenarians controlling the majority of global assets.
Meanwhile, the working class, the people who simply cannot afford to allocate $100,000 a year in post-tax income to biological saws, they remain entirely tethered to the old, decaying biological clock.
They're forced to rely on traditional, increasingly overburdened, reactive public healthcare systems.
They will continue to age, decline, and pass away on the standard 80-year timeline.
You are creating two distinct biological classes of humans living side by side. It will undoubtedly trigger intense, likely violent political and philosophical debates.
Governments will be forced to answer a fundamental destabilizing question.
Which is?
Is access to AI-driven biological longevity an absolute, universal human right that must be subsidized by the state, or is it simply a luxury consumer good, like a private jet, reserved for those who can afford the capital outlay?
And while society is tearing itself apart trying to answer that philosophical question, we also have to look at the immediate mechanical problem. How does a government possibly regulate a software that generates physical biology?
The regulatory nightmare is the second major structural risk, and it is a big one.
Because the regulatory bodies we currently rely on to ensure safety, like the Food and Drug Administration in the United States, were architected and optimized for a completely different technological era.
They were structurally built to evaluate blockbuster drugs that took 10 to 12 years of manual chemistry to develop. The entire bureaucratic machinery, the review boards, the legal frameworks, it is all paced for analog science.
They are equipped to handle a slow trickle of new molecules.
Exactly. They simply do not have the foundational framework, the highly specialized personnel, or the massive computational processing power required to evaluate 1,000 entirely novel AI-generated molecules submitted for approval every single week.
The sheer volume of generative output will just break the analog regulatory system.
It already is. So what is the proposed solution? If the FDA can't physically run a 10-year double-blind placebo trial on a hyper-personalized drug generated for one specific patient's digital twin, how do they ensure it doesn't kill the patient?
The necessary shift, structurally, will be a forced move toward in silico clinical trials.
Meaning the trial happens entirely inside the computer's memory.
Yes. Instead of testing a novel drug on a live physical human being in a hospital ward, you simulate a human organ's physiological response using a massive AI model running on a cluster of GPUs.
You mathematically prove the drug is safe in a virtual environment before ever manufacturing it.
But this creates a new, incredibly dangerous bottleneck.
How so?
Whoever controls those baseline simulation models, the private tech company that builds the virtual liver or the algorithm that validates that the in silico trial is accurate, they will become the new, centralized, incredibly powerful gatekeeper of global medicine.
The power shifts from government bureaucrats to private artificial intelligence engineers.
Which brings us to the final and frankly most terrifying point of all, the severe security risk and the collapse of the barrier to bioterrorism.
This is the one that keeps people up at night.
I want to pull a thread from earlier in the episode. Let's do a callback to the generative chemistry segment. Remember the prompt we discussed?
The one instructing the AI to design a highly specific, non-toxic molecule that perfectly targets a cancer receptor, survives stomach acid, and crosses the blood-brain barrier.
Yes. The prompt that engineered a miracle cure. The structural reality of artificial intelligence is that it is fundamentally amoral.
It doesn't know the difference between curing a human and killing a human.
No, it only knows how to optimize for the variables in the prompt. The exact same generative AI architecture can be used in reverse.
The structural vulnerability is explicit. A bad actor sitting alone in a laptop terminal anywhere in the world can prompt the AI to design a pathogen.
They can input a prompt specifying, design a novel viral structure that is highly contagious through aerosolized transmission, remains completely asymptomatic in the human host for 30 days to ensure maximum global spread, and then triggers an irreversible lethal immune cascade.
And the AI, using the exact same latent space search and physics simulations, will output the perfect blueprint for a weapon of mass destruction.
That is the ultimate hammer dropping on global security. For the last 70 years, the barrier to entry for biological warfare has been astronomically high.
To create a novel bioweapon, you needed a state-sponsored bioweapons facility, massive physical containment infrastructure, and hundreds of highly vetted PhD scientists.
You needed the resources of a superpower.
Exactly. But the democratization of biological engineering means that the barrier to entry for extreme bioterrorism has entirely collapsed. You no longer need a massive facility.
You just need a high-end graphics card to run an open-source generative AI model and access to a commercial physical DNA synthesizer to print the output.
The biological printers we talked about earlier, the picks and shovels.
Yes. The machines that turn digital code into physical biological material. Securing those DNA synthesizers, heavily regulating who is legally allowed to purchase them, and implementing cryptographic monitoring on what digital code is being sent to them over the internet to be printed, that is no longer just a regulatory issue.
It is a matter of supreme existential national security.
We are rapidly entering an era where physical biological code can be hacked, open-sourced, and weaponized just as easily and anonymously as a computer virus.
It is a deeply sobering reality that forces us to look at the macro timeline. Let's step back and look at the 10-year outlook. Based on everything we have unpacked today, what is the final structural thesis of this transition?
The final thesis is that the fundamental nature of humanity's relationship with the physical world has permanently changed. For the entire history of our species, we have merely lived within the natural world, completely subject to its random genetic mutations, its diseases, and its inevitable biological decay.
But we have crossed a threshold. We are no longer observing nature, we are programming it. Biology has officially transitioned from a soft science into a hard information technology.
Let's do a quick 3-bullet recap of the core data points we've covered today to lock this mental model in place for you. First, generative artificial intelligence and the AlphaFold revolution have officially broken Eroom's law, fundamentally compressing drug discovery from decades of blind manual guessing into months of targeted, highly efficient generative engineering.
Second, the real compounding economic wealth is not found in binary biotech lottery tickets, but in owning the infrastructure, the automated cloud labs, the proprietary data monopolies, and the high-margin recurring biological saws of local AI longevity clinics.
And third, this unprecedented power brings unprecedented systemic risks, primarily the profound societal threat of biological inequality and the complete collapse of the barrier to global bioterrorism.
It is the ultimate double-edged sword. It is a delicate, highly volatile balance of immense promise and profound peril.
And that data leaves us with a final, highly polarizing thought. I want to turn this directly over to you, the listener, to analyze your own risk tolerance and ethical framework. If an AI longevity clinic could mathematically guarantee you an extra 20 years of high-quality, healthy life, but the compounding biological saw subscription cost $100,000 a year, would you take out a massive loan or liquidate your assets to pay for it?
Is this new era of programmable biology the ultimate triumph of human science? Or is it merely the architectural blueprint for extreme, irreversible societal inequality?
Think about the economic reality of that choice as you process everything we've unpacked today. If you want to continue exploring these complex business case studies, the realities of future tech, and how to intelligently navigate these massive structural shifts in the market, be sure to subscribe for more deep dives. Stay curious, stay positioned.
Not financial advice. Do your own research.